If you're looking for something that's really fast-paced and the opportunity to really help individuals, not just athletes, but also everyday people, then athletic therapy is really a great profession to pursue. My name is Val Pellick. I'm a faculty member in the Department of Kinesiology and Applied Health. I'm also a certified athletic therapist and a graduate of our athletic therapy program here at the University of Winnipeg. Part of my job is to look after our athletic therapy practicum program, and I also teach courses like human musculoskeletal anatomy and assessment of injuries. At the University of Winnipeg, we can specifically offer smaller class sizes that allow you to interact with your professors and instructors. We really get to know you one-on-one, and we can really tailor things like your practicum placements to your interests and make them as student-led as possible. Students who pursue athletic therapy at the University of Winnipeg can expect to take the foundational courses of Year 1 and Year 2 in our kinesiology degree, and then transform it and build upon it to now learn about athletic therapy as a profession. They also need to be prepared to take what we teach them in class and in their labs, and then take them into their practicum placements where they can actually put those skills into action, working with different athletes and everyday people in a clinic environment. In terms of the knowledge that students will gain in our program, it will be everything from injury prevention and mitigation, treating injuries, rehabbing injuries in a clinic setting, taping, and dealing with on-field and sideline care. They really develop their critical thinking skills throughout their degree. They need to take what they learn in class and then make that knowledge work in a practical setting. They also develop really great communication skills from interacting with athletes and everyday people in their practicum placements and trying to extract information from them about their injuries or what they're feeling, and then communicate back to them what their injury is and what their plan is for them. Students who are studying athletic therapy at the University of Winnipeg are very busy students. They are taking a full course load. Lots of those courses have labs, which is a key component because it's the hands-on element. And then they're also in their practicum courses at the same time. So time management becomes a huge part of what we try and teach them about, and sometimes they need to learn as they go what works and what doesn't in terms of managing day-to-day life. And also just personal organization skills is something that we really work on together to try and make sure that students are getting the most out of their courses and their placements, but also still having time to unwind at the end of the day or the end of the week, and having just good personal mental health as well. So a huge part of our program is our practicum courses. Students will take 2 different practicum courses over 2 years. Part of the practicum courses are in a clinical setting, so they'll work on campus here in our University of Winnipeg Athletic Therapy Center. They'll also work in a community athletic therapy clinic. The other part of it is working in a field setting where they'll work with sports teams, both with Westman teams and also any type of amateur sports team. One of the huge benefits of doing this is they not only take their skills and put them into practice in a supervised setting, but it's also a way for them to network and build connections. It's a really great opportunity for learning, but then also planning for the future once they're a certified athletic therapist. Once students graduate from our program, they have this wide variety of skills. They're then eligible to write the national certification exam with the Canadian Athletic Therapists Association. And upon successful completion of that exam, then a student earns the right to the title of athletic therapist. A lot of them will choose to work in clinical practice, where they treat athletes and everyday people with their injuries. They might also choose to work in a field setting, where they could work with amateur sports teams or even professional sports teams. They would be in charge of injury management during games, during practices, and everything in between. So there's really a wide variety of job opportunities, and a lot of students will choose to combine both field practice and clinical practice together. Our graduates really need to go after jobs and opportunities that maybe don't say athletic therapist in the title, but their skill set will lend itself to those jobs. They also need to realize that there are jobs out there that just haven't been created yet for them. So I'm hoping that part of our instruction in our program is to give them the confidence to be able to go after some of these opportunities and carve their own path, even if they're the ones that have to be trailblazers for those jobs.